It's important to hold the HSJ Cancer Forum because we've never seen such a high volume of referrals, so some of the statistics could be kind of alarming, but the service, as always, has a load of really interesting, innovative ideas for how to mitigate that and even improve services despite what some people call a crisis in cancer care. And we had a really good turnout from senior people from Cancer Alliances, and it's often staggering to outsiders just how much innovation there is in the NHS, but then often how lumpily it is distributed. So getting that porridge a bit smoother is an absolute benefit of an event like this.
It was my first time coming to the Cancer Forum, and I found it really interesting because it brings together lots of different stakeholders involved in delivering cancer care. You have industry, Cancer Alliances, clinicians, and other members of the healthcare professional workforce.
In my keynote, I gave a progress update on the National Cancer Programme. It's been about 3 years since we've had the majority of our funding given in the spending review in 2021. To give a bit of an update on what we've achieved in that time so far, particularly the 2% rise in early diagnosis that we've seen and meeting the FDS. One of the main challenges for us is going to be about how we balance all the progress we're making on early diagnosis with the pressure on cancer waiting times. That is understandably always going to be a priority for the government and the public, but obviously the more patients we find early and try to treat early, the more pressure that is going to put on waiting times. We have turned a corner on that, but it's going to be hard to sustain that going forward.
The panel was about addressing the capacity issues in the NHS. We talked from the primary care perspective through to secondary care, the different innovations and practices that we're putting in place. So we talked about GP direct access, community diagnostic centres, and then changes in how pathways are run in secondary care.
Our session today was talking about getting patients to earlier treatment, so the ability to get patients through a pathway, but also earlier diagnosis, more targeted screening pathways such as the targeted lung health checks, and then the newer treatments that are coming on, ensuring that we've got systems in place to allow us to deliver as much of those treatments as we can to as many patients.
The biggest challenges around health equity is always around maintaining it as a priority. So we recognise there's short-term wins, there's long-term gains, but everyone is working at full capacity. So how do we have those difficult conversations and how do we maintain it at front and centre in all of the things we're doing?
It was really important to be there as the third sector as well, so being a charity partner and being able to talk about how we work with industry as well as NHS to make sure that PPI patient involvement can really guide projects, and it was really nice to be able to share that expertise with the room.
Taken away from today, copious notes on different things, lots of best practice, new ways of working, innovation, and just meeting new colleagues as well.
Not only is it a great networking opportunity, you go away invigorated that you want to try new things.
It's just been really good in creating that general sense of momentum and shared progress and optimism that feels really prevalent in the cancer community right now.
That ability to sit and listen to the hard work people are doing and then translate that into national delivery for me is the exciting part of what today's brought.